encourage you to have your screens on. You're all on mute, but it's quite nice to see people. If you can switch, is it possible, Elaine, for people to switch their screens on, or is that not possible?
Yeah, they can. Yeah, people are welcome to, I think.
So if you'd like to, be good to see you, but if you don't want to be seen, that's fine. We'll assume you're there even though we can't see you. We'll give it another minute. We'll start. Oh, well done, Alexandra. We can see you. Not too shy. So we're up to 20. We're expecting 60. We don't think we will get to 60. But we'll probably get a bit more. Hi, Terry. Good to see you. We're encouraging people. Oh, and hi, Heather. Look, hi. As it was pretty cold up there.
Absolutely freezing. Really cold.
At least your face is pink, not blue.
Yeah. It's global warming, you know, causing extreme weather here in the northeast.
Yes, yes. Right, we're gonna start in a moment. We're just letting a few more people join. There's Anandita joining. Okay, well let's get started. It's 2 minutes past 12. So welcome everybody to this webinar on levelling up and how it fits with the climate crisis and the nature crisis. So I'm Richard Smith. I'm the chair of the UK Health Alliance on Climate Change. I hope most of you know something about the Alliance, but there's probably some of you there who don't. So we're an alliance of organisations of health professionals. Most of the Royal Colleges of physicians, GPs, surgeons, nurses, pharmacists belong. We have vets and dentists. We've got 37 members altogether, and our members number over 1 million. So it's much of the NHS workforce. And we work to mitigate the effects of climate change, to promote adaptation. As you're all well aware, it's already here, so we're having to adapt. And we look to promote the health benefits that will follow if we do all the things we need to do to mitigate climate change. And we're very aware that the climate crisis is also a crisis in justice. The problem, as you all know, I should think, was created by the richest countries and the richest people in those countries, but the effect is suffered most by the poorest countries and the poorest people in both the rich and poor countries. So that's applicable here. So all of this is very relevant to the debate on levelling up, and we, the Alliance, have campaigned on the Levelling Up Bill to encourage changes that will both help the poorest and mitigate the climate crisis. Levelling up, and it's not a phrase I'm terribly fond of, it has a slight sort of Orwellian touch to it, but you know, we've known for the importance of social determinants on health, things like wealth, income, education, housing, agency. I mean, we've known this for 2 centuries. It's not a new thing at all. But in recent years, things have become worse, not better. I don't know how many of you saw last week's Economist that not only reminded us of the substantial and growing gap in life expectancy between the richest and the poorest, but also how life expectancy has fallen amongst the poorest in this country. And they calculated that there had probably been some 250,000 excess deaths in the last few years, most of those deaths being amongst the poorest at all different ages. So that's the kind of context to today's discussion. So we're going to have 3 speakers who are going to speak for about 15 minutes each, and then we'll have a Q&A. You can put your questions into the chat, but I encourage you, I mean, there aren't that many of us, I'll ask you to ask your question, but if you don't want to do that, I'll ask it for you. So we're going to hear talks on home energy sufficiency, urban transport, and green spaces. So keep yourselves on mute unless we ask you to ask your question, but we do encourage you to have your camera on. It's quite nice to see real people. The whole thing is being recorded, so if you don't want anybody to know that you're here, now is the time to disappear, but I'll assume that's not the case. And like I say, put your comments into the chat. Right, our first talk, and we've practiced getting up the slides, so we hope we won't spend 10 minutes messing around with that, is James Milner. He's an assistant professor and researcher at the London School of Hygiene and Tropical Medicine, who, as you all know, are kind of world leaders in research into climate change and health. His research involves mathematical modeling, which probably sends a tremor through everybody, of environmental interventions and their impacts on human health. And he has a particular focus on assessing the health effects of climate change mitigation actions. So he's going to be talking about home energy sufficiency. Right, over to you, James. Away you go.
Thank you very much. I'm going to try and share my screen, which is obviously not working.
Well, keep trying, Joe. You've succeeded before.
Okay, yeah, you have to have it maximized. Okay, right. So it's, hopefully you can see that now.
Yep, it's appearing.
Great, thank you. Thanks very much for inviting me. Delighted to be here. I'm James Milner from LSHTM. I promise I won't go into too much technical detail about modelling, but that is my background. I model the effects of environmental policies on people's health, and I'm particularly interested in this idea of climate change mitigation and the more immediate benefits that can bring to people's health. So today I'm going to talk about home energy efficiency and health, which is a topic I've been interested in for a number of years now. So my talk has a fairly simple question, but with a slightly more complicated answer. So the question is improving home energy efficiency good for your health? So I'll try and talk you through a bit about what we know about that and to try and explain a bit about why it's a little bit more complicated than it might initially sound. But I'm going to take a step back before I do that and just introduce this idea of climate change mitigation and health in case some of you aren't familiar with it. As you know, we have to rapidly, urgently reduce our greenhouse gas emissions. In addition to the longer term benefits that will bring through preventing, reducing the effects of climate change, many of those actions that we need to reach our net zero targets can also affect our health in the shorter and medium term. Those are often referred to as co-benefits because they generally are beneficial for people's health, and that tends to happen because many of the sources of greenhouse gas emissions are also sources of pollution, so air pollution, for example, and also because many of the things we have to do will also have effects on increasing healthy behaviours. So, for example, switching to more sustainable diets or to more active forms of transport like walking and cycling, getting people out of cars and being more active. We in our research and others in health communities tend to try and use this as an additional argument in favour of action on climate change, whether that's informally, just to try and promote the agenda, or whether it's more formally, so through trying to quantify these impacts and maybe even monetize them, and then they can be used as a kind of accounting, the costs and benefits of climate action. But I should also stress, and I'll say more about this in a second, that there are also negative impacts of some of these actions, and I'll say more about that in a second, and that's one of the reasons why I'm never that keen on the term co-benefits, but I'm going to use it here as a shorthand, just so that everyone knows what I mean. So in the housing sector, there are really, broadly speaking, two types of action that countries like the UK will be taking to try and reduce greenhouse gas emissions. The first, and where most of my focus has been, is on increasing home energy efficiency. So there I'm talking more about actions that improve the fabric of homes. So really the exterior, the walls, the roof, the windows and things like that, to try and save energy and try and save emissions. There are also other types of actions we might take in housing. So I've labeled those under switching to cleaner fuels. So that, that includes things like moving away from, decreasing the amount of gas that we use, moving more towards electricity for things like cooking and heating. So thinking about also things like the increases in wood burners over the last few years, which has led to a lot of pollution inside homes and pollution out into the local environment. But I'm going to focus more on increasing home energy efficiency, and by that, we've tended to think of it more in terms of the kind of, rather than there are kind of extreme measures you can take to make homes more energy efficient. I'm talking more about the more almost low level things, the changing to double or triple glazing, to increasing the efficiency of walls through insulation and roof insulation and things like that. And the context is that we need to do this quite urgently, because housing is responsible for about a quarter of the UK's CO2 emissions, and about half of that comes from space heating. So there's a lot of potential here to reduce our emissions. But the task is enormous. And I'm not sure a lot of people really appreciate how enormous the task is, because it involves upgrading almost all the existing homes in the UK to try and meet our net zero targets. So almost all the homes, and I forget how many homes there are, but it's tens of millions. Is it 25 million or something, will need to be upgraded with better insulation, double glazing and all those sorts of things. And what's interesting is that there's relatively little real life empirical evidence on the effects that that'll have on people's health. I'm going to talk a bit about some of that evidence, and then talk about some of the modelling evidence that complements that. So most of the real life evidence comes from a number of intervention studies, mainly from the UK, Europe and New Zealand, but there are also some studies in North America, and I think some in Japan, probably some other places now. Some of those are actually very good studies. They're now studies that where there are randomized, essentially randomized controlled trials, but there aren't very many of those. And there are some problems with other studies. So often it's difficult to randomize. You can't always have a control group that doesn't receive home energy efficiency. So it's quite expensive and difficult to perform these studies. So there aren't that many of them. But of the ones that have found that home energy efficiency increases the warmth in the winter of people's homes, and they've found a variety of positive health effects, including respiratory symptoms and other chronic disease symptoms. So things like heart disease and things like that. Improvements in general well-being and mental health, health service contacts, so things like GP consultations and hospital admissions, and then absences from school and work. Those are particularly have been found for people with underlying chronic conditions, so tending to be more deprived communities, people with underlying conditions, and particularly respiratory conditions, so things like chronic obstructive pulmonary disease. And here's an example of a very good recent study. This was published a couple of years ago in the BMJ. So these same authors previously did a randomized controlled trial of a home energy efficiency scheme in New Zealand, and they've now gone back to that data to see whether that reduces in people's exposure to cold, reduce the number of hospital admissions. And they had a control group. There's around about nearly 1 million people in the study, so it's a huge study. And they found that hospital admissions before and after the intervention increased in both groups, but there was significantly less smaller increase in the group that received the home energy efficiency intervention. So they concluded that this national home insulation intervention was associated with reduced hospital admissions, supporting previous research which found an improvement in self-reported health. And that line's quite important, because a lot of the previous empirical evidence is actually quite mixed, as I was suggesting earlier. So a lot of the studies are quite small. They often don't have control groups, which makes it harder to interpret. a lot of the time the health outcomes are quite short-term, self-reported outcomes. So it's more like surveys, you know, asking people about their symptoms rather than using sort of hard endpoints that are more easy to quantify. It's also quite difficult to interpret the pathways. Now, I'll say a bit more about this in a second, because there are lots of them. It's affecting the temperature, it's affecting people's exposure to pollution. It might be affecting their, you know, whether they're in or out of fuel poverty, the amount of money they have and what they choose to use that money for, whether it's for heating or for something else. And then finally, one thing that's really important, it's been quite a focus of the research we've done over the last few years, is that there's very little evidence on the effects of ventilation. And that's important because one of the ways that home energy efficiency works is that it makes the building more airtight to try and, you know, reduce drafts and therefore to save energy being lost out of the home. But that has the effect that it could trap pollution that's generated inside the building. So it'll protect people from the outside air, but it could lead to an effect where people are more highly exposed to pollutants that are generated indoors. And to give you a few examples of that, that's mostly based on modelling. These are some results from a paper we published a few years ago. And we modelled the effect in the UK housing stock of improving home energy efficiency under a few different scenarios. And we modelled the effect on radon, and we chose radon as a representative pollutant because the evidence on adverse health effects, in this case lung cancer, that evidence is very strong. So we can quantify this with quite a lot of certainty. So we model this into the future. This plot shows life years, which is a measure of the total amount of life lived by the population under different scenarios. So if it comes down, that's a bad thing. If it goes up, that's a good thing. And in our first scenario, we said, what if we do these interventions, but we don't do anything about ventilation? So that increases the radon and increases the lung cancer risk. And you can see we get this quite large adverse effect on people's health. The other scenarios were various combinations of what if we did this alongside ventilation measures and things like mechanical ventilation is some of the tightest, most airtight dwellings, which you can't do this in all dwellings. But the main headline message is that if we don't take account of ventilation, there's definitely the potential for things like radon to increase in people's homes and to increase lung cancer risk. And although I apologise for the quite messy plot here, but this is some work from my colleague Phil Simmons at UCL, and he went, after we did this modelling, he said, well, let's look at the real radon data, because radon information is collected, and let's see whether we can actually see anything happening in the data. These plots show distributions of radon levels in people's homes in high radon areas, but what they're showing is that the red bars show the distribution for all the homes. So hopefully you can pick out the red bars, and you can see it's roughly like a normal bell-shaped distribution. And then the other distributions show homes that have had certain types of energy efficiency measures. So the DP means draft proofing. I think the other ones are glazing, loft insulation, and wall insulation. And what you can hopefully see there, although apologize, it's not the easiest thing to interpret, is that those distributions are shifted slightly to the right, which means that, so the other colors, the distributions are shifted up to the right, which means higher radon levels. And then in the plot on the right, it shows homes that have different combinations of measures. So they've got more than one measure, and they're shifted even further to the right. So they have even larger increases in radon concentration. So it looks from the data that we do actually see these effects that we're modeling. We tried in another study to model the overall effect of various indoor exposures on people's health by modeling the whole UK stock and what would happen in a realistic home energy efficiency program. And you could see we did it with 3 different scenarios. And the regulation one is, what if we assume that the regulations are met and people do pay attention to ventilation? So that should be good for people's health. What you can see in all of those scenarios is that the heat loss goes down, the heat system becomes more efficient, and the permeability, which is the air tightness of the dwelling, goes down. So that's in all three scenarios, that's what we would expect. But what happens to the exposures depends on what you do about the ventilation. If you assume that the regulations, the building regulations are met and people do install extra ventilation, the temperatures will go up in the winter. We think that the indoor air quality would be improved. There might be some extra actually outdoor air pollution coming inside, and there'd be a decrease in mold risk. The problem is that the guidance is very, very unclear. So there is some regulation in building regulations, but it's not very clear how it's supposed to be enacted, and it's more like general guidance. So people tend not to do this when they increase home energy efficiency. So we also modeled a couple of scenarios where we said, well, what if people don't install any ventilation, or what if we leave it to the discretion of installers? So in the data that we used, there was a measure of whether there was mold, and we used that as a marker of when people might say, well, there's mold, that we should install extra ventilation. But in those two scenarios, although that you still get this benefit for winter temperatures, the indoor air quality became significantly worse. So things like particles generated inside, radon, secondhand tobacco smoke in households where there are smokers got significantly worse. There was some protection from ambient air pollution coming from the outside, but the mold risk got worse as well. And when you put this together, and we tried to model the effects on people's health. So the regulation scenario where the regulation is met is the one at the bottom there, the kind of blue purple bar. And we found that had a significant overall benefit for people's health. But these two other scenarios, the kind of orange and green bars there, the ones where we didn't pay enough attention to ventilation, in those ones, we thought that overall the balance could be negative for people's health. So overall, this could be, if we don't do this properly, it could be a bad thing for people's health. So finally, the slightly long-winded answer to the simple question that as long as these interventions are properly installed and maintained, home energy efficiency should be beneficial for people's health, because it improves the temperature in the winter and it protects people from ambient outdoor air pollution and can protect them from indoor air pollution. And there are other effects, as I've said, about saving people money and things like that. But this potential for reducing ventilation as an unintended consequence is potentially quite serious, and it could make indoor air quality worse into the future. And there's a danger that we could, if we don't do this properly now, that we'll embed these problems into the future and make people's health worse in the future without meaning to. So what my message, and I think of my colleagues, is that we just need to make sure that we do this properly rather than having to deal with new problems in the future. And to do that, we really, really need to understand more about how home energy efficiency affects ventilation. And then we can start to understand more about how it might affect indoor air quality and people's health. So thank you very much for listening. I think that's my last slide, so I'll hand back over.
Good. Well, thank you very much, James. I think that's a very important message. You mentioned the scale of all this. The figure I carry around is there are 23 million homes in Britain that need to be retrofitted, and a lot of those are very old homes, many of them in pretty poor condition. And I think you make it very clear that doing the right thing is very important, and things that seem rather tedious, like building control and such like, are actually very important. So I'd remind everybody to put your questions while you're thinking of them into the chat, rather than forget whatever the question you want to ask is. Right, now we're going to move on and hear about urban transport. We're going to hear from Oliver Lord, who's the head of strategy and UK campaign at Clean Cities. He's delivered successful air quality policy and campaigns for the Mayor of London, leading work to reduce harmful emissions from vehicles, such as London's ultra-low emission zone and zero emission vehicle strategy. Most of you will be aware that the ultra-low emission zone is being expanded at the moment, which is causing quite a lot of controversy. And we're very much in favour of ultra-low emission zones. So over to you, Oliver.
Thanks so much. Thanks for having me. It's really interesting coming after presentation on buildings and homes, I think, because the scale of the challenge there is so great, and it is with transport too. But I think we've got more responsibility in the transport sector to kind of be speeding up a lot of the interventions that we can introduce, because I think actually we've got a whole shelf of interventions that can be done quite quickly. So quickly on the Clean Cities campaign, if you've not heard of us before, because we are quite fresh, we launched almost 2 years ago. We're actually born out of Transport and Environment, a charity in Brussels that's been going about 30 years, who have been heavily influential in the phase out of the internal combustion engine legislation that's going across Europe. And our campaign is about applying pressure on city leaders to introduce what we're calling very techie zero emission urban mobility. So it's basically helping people to get around towns and cities without harming the environment or their health at the same time. It's not about asking people to not do things, it's about just giving people the alternatives to do that. So we want to rethink urban mobility. We want to reallocate public space. We want to get more investment in shared transport, phase out those polluting cars, and eventually get to a point where the vehicles that remain are zero emissions. So that's sort of the pillars of our campaign. And we can do this, right? You know, I thought James explained very eloquently like how we can do it in the housing sector, and the same applies to the transport sector. And I just like to use that idea when we look back to the Clean Air Act in the 50s and how we phased out power generation in our cities, which are causing such drastic impacts on people's health. Not to say that the Battersea Power Station redevelopment might be to your taste, but it just is basically the bigger picture here that, you know, policy can actually make a massive change on people's health and help us live healthier lives. So on transport emissions, perhaps it's worth me just covering briefly that, you know, it's obviously law that we've got to be achieving net zero, and transport has a big role here, responsible for about 27% back in 2019. I'm not sure how much that has changed in the past couple of years. But importantly, the transport emissions have been broadly flat. They haven't necessarily been reducing for the last 30 years, even though other sectors have declined. If you think about energy generation would be an example of that. And quite frankly, it is cars are a big chunk of the wedge. And then we're also coming at it as a campaign from an air pollution perspective. I'm speaking to a lot of health professionals, so I'm actually much more from the campaign perspective. My academic background is psychology, so I'm really interested in how we influence and change people's behavior. But a particulate matter is a big issue for us, really fine stuff. I mean, that's the diagram compared to a human hair. And on the right, this is like nasty stuff that vehicles generate as much as other sources. And on the right, you can kind of make out like a fried egg in the photo. This is a child's sputum. In the fried egg, just above sort of the yolk, is kind of like those little dots of black. That's actually particulate matter. And, you know, this is a pollutant that we're grappling with greatly. World Health Organization limits have changed quite significantly recently, and we're nowhere near achieving those. And the same applies to nitrogen dioxide, which is a really harmful gas that is predominantly generated from diesel vehicles when it comes to transport. And it's obviously really bad when you're kind of walking along the road. So, you know, the contribution that road transport and urban transport plays on your health when you're walking alongside the road is obviously far greater. And we've not been meeting legal limits that were meant to have been met in 2010 for this pollutant. Air pollution also really affects marginalized communities as well. You know, when you look at the emergency asthma emissions against the index of multiple deprivation, when we look at how polluted places are compared to, you know, how wealthy people are in those areas, it all comes out quite poorly for the most marginalized communities. And I also just want to put a flag for noise pollution as well. I think it's a bit of a forgotten pollutant, but boy, does it literally stress people out and can lead to big health impacts actually as well. And we're breaching a lot of the World Health Organization limits for that as well. So when I was asked to think about leveling up urban transport, I kind of reflected on some of the campaigning we've been doing recently and some of the things that are in the news of late. And I think it's really timely today to be having this presentation whilst we have a big budget underway. So one of the things that screams at me really is investment in public transport, as you will probably expect me to say. But most importantly, the statistic I took from the Campaign for Better Transport recently is that train fares have broadly increased by about 35% in the past 10 years. Bus fares, at some point, it was around 65%. And we've done our own analysis that shows that the top polluted cities in the UK, so London, Manchester and Birmingham, when we look across Europe as a campaign with about 36 other major cities, they have got the most expensive public transport in Europe. And the rate of increase and the cost of public transport fares is incredibly unfair when you set that against the freeze to the fuel duty as well. It's just not sending the right signal, let alone it being unfair. So massive plea to the Chancellor today. Could you imagine if he put forward proposals to even offer cheaper or even free public transport, as they have been doing in Germany? And it makes a difference, right? Because, we've looked recently at the number of cars, for example, registered in Manchester, and how that's increased by about 31% over the past decade. But then when the Mayor of Greater Manchester is given the power to start to control the bus fleet much more, then we've actually seen a boom in the number of passengers that are kind of using that bus fleet as soon as like £2 fares come in. And it's I hasten to add that he actually did that before the government policy, but it all kind of goes together. And we do know that it's the people on the lowest income that are actually least likely to be owning cars at all. So this kind of all helps to reduce health inequities as much as anything else. Here's a great example, a great photo I took on Sunday. We organised a mass bike ride for families and children in London called Critical Mass. And I think, I basically put that here because I want to talk a little bit about cycling as well, because we need to reduce car dependency if we are going to reduce these harmful emissions. You can see that when you look at the car ownership data in London and set that against physical activity, there's a very clear well, to some extent, I'd say quite a clear correlation. And this is about how we've been building our cities, right? This is a picture of Vauxhall Gyratory. What signal is that sending to people when it comes to what mode of transport shall I use? You've got a puny cycle track on the right, and then you've got 5 lanes of traffic. So we've been building this for years, and we really need to unbuild it. But even today, we've seen the government introducing devastating cuts to the active travel budget across the country, and we need to try and undo that. And there is also an option to level up these communities who, for those that do own the cars, are likely to be older cars, which are actually generally more polluting cars. So they're trapped in the car dependency, they're owning the more polluting cars and polluting their own families, communities. How do we try and just reset that and introduce something significant? And the scrappage scheme, as some of the cities have been doing, helps, but we do need to see much bigger support at a national level, I think, if we're going to reset this and help people get out of polluting cars. And there's also something to be said about planning. In London, about half of all front gardens are paved over, mostly to park cars. So wait for it later this year when we get the big floods again. And you start to think, well, actually, wouldn't it be better if we were not paving over our front gardens, because gardens actually soak up that rain and can increase the rainwater runoff quite significantly. And then thinking about some of the campaigning we've done recently, it's also to me about making things easier. So this was these are loads of photos taken from a campaign we did called "This Is Awkward," which is actually, if you even wanted to try and use a bike in the city and say you install loads of bike lanes, where the hell do you keep your bike? Our homes aren't necessarily created to make things easy for us. So these are loads of photos that people sent in, and the really awkward places they have to keep their bicycles at home. And this is just another way of making it difficult to not use your car. And linked to that is also the cost of, even if there is a solution, which there is, I've put a little photo there of a bike hanger in the bottom right-hand corner. The cost to use one of those spaces is one space in that hanger, there's 6 spaces, is actually on average higher than the cost of parking your car for a year outside your house. So it's again, it's kind of these price signals that we're not getting right to make it fairer and easier for people to get around without using cars. And I'll do a big plug here for Lambeth Council's curbside strategy. They've been assessing all the roads in their borough and how they're using that space outside people's homes and residential streets, setting it against the fact that a majority of people don't even own a car. So are there better ways to be using that space to make it to make their streets healthier and more equitable for residents and better for resilience to climate change, for example? And then I'll start to end by just saying I think we also need to start with kids as well. Do better to give them cycle training at school, do better to give them safer routes to get to school. In London, around 25% of all the car journeys that are made in the morning peak are actually people taking their kids on the school run. And we also know that parents really believe that walking or cycling their kids to school is much more quality time. So we've got a campaign called Streets for Kids, which is actually calling for more school streets outside of schools, so where we close the road off and reduce their exposure to air pollution and road danger. And also with linked to that is about how we get safer cycle routes to school. So I'll end there by saying please support our campaign. It's okay for me as a transport geek to be shouting about this stuff. We've got lots of climate geeks, of which I know there are probably many on this call, but it's also heavily important that we have health professionals as well, supporting a lot of the asks that are coming out from transport charities. But I'm willing to take obviously some questions later as well. Thanks very much.
Good. Well, thank you very much, Oliver. I mean, I think one of your messages is there's a lot of things we could do quite quickly if we have the energy and inclination. And to undermine the point you were, or underline, not undermine, the point you were making at the end there about the importance of health professionals. I mean, that's obviously what we're primarily about. And we're very active on air pollution and active transport. But generally, I think we feel that health professionals have not been as prominent as we should have been. And that's something we're working hard to reverse. And part of our strategy is to work a lot with others. We don't need to reinvent the wheel. So we're very pleased to hear from people like you. Right, now we're going to move on to green space, and we're going to hear from Felicity Harris. Felicity is the Green Space for Health Program Director at the Centre for Sustainable Healthcare, whom we work with closely. She's vast experience in conservation and sustainability, exploring the relationship between the natural world and human health and well-being, and has a particular interest in capacity building, participatory approaches, and climate justice. Thank you. Over to you, Felicity. You're on mute, Felicity.
Apologies for that. I've shared the screen again. So thank you very much. It's really interesting just hearing Oliver there talk about this notion of kind of, and you, Richard, about working together and interdisciplinary ways of working. And I think that's what I'm going to be touching on today as well. So within the next 15 minutes, what I'd like to do is draw on some of the evidence, but mainly touch on experiences from the grassroots around green space. I want us to sort of explore how we optimize the role that UGS or urban green space has to play in addressing health inequalities, and perhaps reflect back and ask what the health sector can do in this space. I think there's been a lot of talk and an emerging evidence space about the link between health and green space. In fact, it's a compelling evidence space. We see that a lack of accessible green space, poor air quality, and urban heat islands are correlated with higher mortality and poor health. And a review by WHO in 2017 showed that interventions to increase or improve urban green space can deliver positive health, social and environmental outcomes for all population groups, particularly those groups where they're with lower socioeconomic status, so where you might expect to find health inequalities. And, you know, sort of, again, thinking about this in a global context, the UN Sustainable Development Goals, Goal 11 has a number of points, but two are particularly relevant. An aim by 2030 to reduce the adverse per capita impact of cities, including paying special attention to air quality, and to provide universal access to safe, inclusive, and accessible green and public spaces. So some of you will probably be familiar with this diagram from Hartig, which kind of shows the relationship between the natural environment and health and well-being. And we can see that the natural environment, so the presence of like green space, has direct benefits for health in terms of reducing air quality, or improving air quality, and reducing stress. And there are also kind of indirect benefits. So I just wanted to kind of put this diagram.
Sorry, Felicity.
Felicity, we can't see the diagram. Can you move your slides on?
Can you see the?
No, we're still seeing the first slide.
Are you? I'm still seeing the first slide?
Yeah, yes, at the moment, I'm afraid.
I don't know why that is.
Right. I don't know, Elaine, have you got copies of the slides?
Yeah, I can share the slides. I'll get that up on.
Yeah, shall we do that for you, Felicity? And
I'm so sorry. It shows it's moving on here. I don't know where that is. Why that is.
Okay, I've got it on the screen now, Felicity. If you want to just tell me when to move on to the next slide.
So if you can move on several slides, please, Elaine. And again, so if we stop at this diagram here. It's from Hartig 2014, and it kind of shows the relationship between the natural environment and health and well-being. And we can see that there are, just simply by having natural environment in places, we can improve air quality and we can reduce stress. But if we have contact with environment, there are indirect benefits, and use that environment again, just by being the natural environment being there, it means, and if people are using it, it can lead to improved sort of physical activity. It's a place where people have physical activity, which has health and well-being benefits, and it's a place where people can come in contact with each other, and that social connection is really, really important. And Elaine, if you could move on slide, please. One of probably the most profound or wow moments I've had in my time was up in Merseyside in Liverpool. An organisation called Land Life had sown sort of pocket perennial meadows all across the city, so little places of derelict land. They'd sown patches of flowers, and we're talking very, very small patches of flowers. And it was just outside football stadium in Liverpool. You've got rows and rows of terraced houses, a lot of them boarded up. And I just happened to be there because I was working with this working as a partner with this organisation, and there was an older lady and gentleman sitting outside one of these terraced houses, opposite what had just been a sort of little derelict gravel area with where wildflowers had been sown. I said, oh, it's, you know, really nice to see you sitting outside, it's June, enjoying the weather. And they said, you know, before those seeds got sown there was no reason to come outside. We didn't know our neighbours. Nobody wanted to live here. That view, those flowers being there, have given us a reason to come outside. It's great. Everybody started talking to each other. And it was just one of those really wow moments. This is a community with very little access to green space, no access to gardens, you know, tiny little yards, and just this sowing of flowers, this visual access in proximity to where they lived, had sort of changed how people viewed their community. If you could move on, please, Elaine. Thank you. We're kind of asking quite a lot from urban green space. We know that health inequalities exist, that there's a link between access to green space and health, and we know that climate change will exacerbate health inequalities. So we're saying, well, actually, if we have more urban green space, it can address that. We also know that we're losing biodiversity, and we need to expand and connect our natural environment, including the natural environments within urban green space. We're looking to urban green space for climate mitigation, and we're looking to urban green space to help us adapt to climate. And a lot of NHS green plans talk about how they can use green space and improve their green estate to help with climate adaptation. So if we move on to the next slide, please, Elaine. As I said, we're trying to solve a lot of problems. So when we're thinking about how we use our urban green space, we need to ask questions about where the health inequalities are, which communities are we needing to work with. When we're thinking about biodiversity, we need to be thinking about recovery and resilience, climate adaptation. How can we use our urban green spaces to reduce flooding, to reduce air pollution, to modify heating effects? And then we're also thinking about the carbon sequestration. So we are asking a lot about urban green space, which is why it is an interdisciplinary and need to bring different disciplines together. So if we move on to the next slide, please, Elaine. We could say, if we just have more urban green space, that's connected, that's biodiverse, and that's optimized to deliver those ecosystem services, we would expect to see a reduction in health inequalities. And we may, to a certain extent. But if we move on to the next slide, please, Elaine, there's a real need to understand how people come into play in all of this, to understand the fact that just having something there doesn't mean it's going to be used. So if we think about some of our more deprived communities with a lack of urban green space, just putting the urban green space in doesn't mean that those spaces will start being used. So for example, you may be a mother who is concerned, and I've had this said to me before, if my children go outside and play in that space and get muddy, will social services take them away from me? You may be concerned about whether you feel that you can access that space. Am I welcome? Am I welcome here? So there kind of needs to be a dual approach where we focus where we're putting our urban green spaces, but we also work with the communities and with sort of targeted populations to involve them in the co-design of those spaces. How are those spaces going to be used? Who's living in that community? And where are their needs? And that means we need to listen. So if we move on, please, Elaine. We know that access to green space delivers sort of better benefits. It's an equigenic effect, and better benefits, or more notable benefits, for women, children and adolescents, older adults and deprived subpopulations. And that needs to come into play when we're thinking about designing our spaces. So adolescents might just be looking for spaces to hang out, and we need to think about how we all accept that being able to hang out in spaces is an okay thing. It's not a sign, there's not kind of antisocial behavior going on. We might want to think about seasonal variation, and how well lit our urban spaces are that we're providing, because if they're not accessible during the winter months when it gets dark, or they don't feel safe, certain groups may be excluded from them. So if we can move on, please, Elaine. So going back to this slide, if we listen to people and we think about our communities and we involve our communities in co-designing these spaces, then we're likely to sort of get bigger returns in terms of the health benefits of those spaces being there. And if we move on, Elaine, please. So kinds of things we might need to think about when we're working with individuals. We need to listen to individuals and help them, support them. They're in that journey, so they're empowered to access spaces and recognise that that's part of their self-care and living healthily. We need to ensure that our external natural environment is there, it's present, it's resilient to climate change, and it's optimised for biodiversity, and it's accessible. We might want to explore our patterns of thinking and action. Who else do we need to involve in conversations so that green space is used? How do we work with the education system, for example? And we need to understand more about the impacts that different interventions in places are having, so we can learn. If we go to the next slide, please, Elaine. The next set of slides are examples of new or designs for new build hospitals that kind of show that the NHS is really thinking about its green space. And you can see in this image here, we've got I think it's Papworth Hospital in Cambridge, with this green space on the outside of the hospital, surrounding the hospital, and people walking past it. We move on to the next slide. Here is a hospital designed for a hospital in Birmingham, and you can see the green space is being used here. So whether that's the community outside of the hospital community coming in and using the space, or the people within the hospital using the space, this is a green space that's being used. People are relaxing, they're socializing, there's stress reduction, there's trees on the outside of the green space, sort of buffering or dispersing air pollution. And if we move on to the next slide, and we can see this hospital here, which I've forgotten where it is, that's Watford design, where green space is really integral into that new hospital build. So if we move on to the next slide, please. When we think in terms of the NHS green estate, what can we do, or what can we be doing within the health system to maximise the health benefits of urban green space? I think one of the first things we can do is recognise that the NHS does own green estate that can be used and enjoyed and gives value into for communities. We also may want to think about how we can promote activity within the estates, nature-based interventions in terms of supporting staff well-being, but also for patient care and recovery. And finally, how we can bring that green space closer into those hospital buildings and increase contact and connection with those spaces. So if we move on to the next slide, please. In terms, again, of what the role the health sector can play, I think there's an opportunity here for the role of the NHS green estate to be recognised as a healthcare asset, understood and valued. Knowing where it is and how it plays into wider green infrastructure plans within a local area is important. You might want to think about how we optimize biodiversity on that estate and ensure that it's accessible for our local communities. We might want to think about how staff within the NHS can be supported to use the estate, the green estate, for their health and well-being. Within the estate, we might want to think about how we can deliver interventions for those most likely to benefit from interventions, groups that are already experiencing health inequality. So the green estate, perhaps the NHS green estate, as a stepping stone, helping break down those barriers and promote healthier behaviours that support people then go on to use green spaces where they live. And we can be champions for communities, sort of demanding that there should be equity in access to green space. Thank you, Elaine. I'm so sorry about the loss of slides there.
Good. Well, thank you very much, Felicity. Don't worry about we sorted out the slides problem. So I like the way that you emphasize co-design when thinking about spaces, you know, working with the people rather than just letting professionals or experts go ahead and do it entirely themselves. And I like the way that you emphasized how green space can encourage relationships and contact, because I feel rather embarrassed that I've been working in health for 50 years, but I think it's only comparatively recently that I've understood how central relationships are in a person's health. I mean, probably just as important as whether or not people smoke. And I like to go back to what Oliver was saying about emphasizing the importance of noise. And of course, a lot of noise in cities is the result of cars. And I think we've not appreciated the effect of noise on health. It's something that's, as I think Oliver said, has been somewhat put on one side. Right, well, now we've got lots of time for questions, and we've got various questions here already. So Amanda Davis, I wonder, are you still here, and would you like to ask your question if you are here, or otherwise I'll ask it for you? Well, there you are, Amanda, so why don't you fire ahead?
Hello there. So I'm ringing from the North Cotswolds, and we have a big debate between locals versus tourists, and also about rural poverty of opportunity to get places for those opportunities, such as getting to health facilities, getting to be able to go to college where you can go on public transport, and the transport just doesn't cut it. So one of the big debates between the local coach company and tourism officers at council and myself, I'm a board member of the AONB. We want to know whether there's any research, any insight that could help from any of the three speakers around coach journeys, taking 50 plus people at the same time, versus car journeys where you'd have multiple cars making up that same journey. And we have very little access to train routes here in the Cotswolds. Thank you.
Right, Oliver, I think that's probably a question that's directed primarily at you. I mean, I was conscious that as we talked a lot about cities, and we didn't say much about the countryside.
Yeah, I did warn Elaine on that, with us being a campaigner on urban transport, but it's a really good question. And actually, there's an NGO called Campaign for Better Transport who do a lot of campaigning around better bus services in rural communities and not just in urban communities. They've no doubt got some research on this, so perhaps I could try and find something for you. But I'm hearing from you. The question is, like, is there research available that will stack up, that you can present to people to kind of show, look, if you get 50 people on a bus to go from town A to town B, it's going to be a hell of a lot better than getting everyone in their cars. Undoubtedly, but I'm afraid I don't actually know where that is at this very moment. But perhaps you could email me, and I can try and link you up with the people at Campaign for Better Transport, and we can get that to you. Everything I said in my presentation was pretty much we need to reduce private car ownership and private car use, whether that's actually getting more car clubs for rural communities, whether that's introducing like e-bike sharing schemes and things like that. It's all about those last few miles to get to those big transport hubs that we have to try and resolve.
I don't know whether James or Felicity, have you anything to say about this? If you don't feel you have to, but I just wondered whether you had something to contribute.
Not particularly. I was going to say the same sort of thing as Oliver. That unfortunately, most of the research is on cities. Most of and there's quite a lot of, I'm more familiar with modelling research, and it's almost all of interventions and schemes in cities. So there's a real lack of research in rural areas. But I would echo what Oliver said, that I would say almost without doubt, it's better to be putting more people into something like a bus, or than for each of them to be driving separately for both health and the environment. But I think, yeah, we probably don't. I'm not aware of the research that shows that for rural communities.
Amanda, do you want to come back briefly?
Absolutely, thank you so much. I'd love to work with somebody that would like to do that. I mean, I qualified as a health economist, and I chair planning committee as an elected councillor, and I'm a board member of AONB, who's on a working group leading this topic, and I cannot find that research anywhere. We have a local bus company who's next door to my house, who's got Eco or European Standard 6 coaches available, and our tourism at District Council is saying they want to get the coaches off the road. So there's a whole range of different issues that informs car parking. It informs, we're losing our coach park. So there's a disincentive to go by bus or coach anywhere. Do we want to encourage minibuses? That research needs to be there to inform the strategy, so that we can build in the good practices that help people to make easy the right choices. So I'm with you 100%. If anyone wants to do that research, I'm interested.
Sounds great.
Thanks, Amanda. I mean, James, I don't know whether you just want to say something. I mean, generally, there's an awful lack of research. I mean, you emphasised it in your talk. I mean, this whole area is kind of under-researched. If you say compare it with hypertension or something that's massively researched, is there signs of things getting better?
I think gradually. It's partly because it's quite a new area, and so people have come at it from a number of different perspectives, which as a researcher makes it quite interesting, because there's this space to ask different questions and work out different ways of doing it. But it's true across all these areas, in housing and transport and green space, that the research is lacking. I was interested to ask, what Felicity finds the same, that whether research in whether more or different research on green space would help to make the case for improving green spaces.
Felicity, do you want to comment on that?
We're going to Amanda's question around transport in rural areas. I think it is, it's a massive issue, and sort of like thinking about we have, as you said, we've mainly sort of focused on levelling up in urban areas, but having also worked in rural areas and with communities and in the kind of field of green space, I think, it's very easy to have an assumption, okay, so people who live in rural areas must be using green space and must be doing all these, they've got nature on their doorstep, they must be doing X, Y, Z. And that's not the case. That isn't the case either. There are sort of like multiple barriers to people in rural areas accessing green space, and particularly younger people accessing functional green space for play parks and things like that. And I think in that regard, I think maybe there's a sort of there's a really important question coming up here when we're thinking about levelling up. Is our mind sort of totally turned just to thinking about urban communities? Are we ignoring at our peril the kind of social isolation and the challenges faced amongst rural communities? I do think they get forgotten. So I think it's a good question to make us all think, Amanda, about levelling up of rural communities as well.
I have one final comeback, which is the killed and seriously injured indicator. When you go out walking, cycling, or horse riding, you're twice as likely to be injured on the roads. You know, that's a big one. We haven't got space for 2 cars to pass sometimes, you know, never mind putting in a cycle route. So some of these thoughts, I would love that to be part of the levelling up agenda. Thank you.
Good. Well, thank you very much, Amanda. I mean, I echo what you say. I find it a lot. I live in central London, and cycling is comparatively safe compared with cycling in the country, where suddenly a car can come whizzing around the corner. Right. So Terry, over to you. You've got a couple of questions. Ask them one at a time.
Thanks. The first question is really about the clean air zones, which seems to be unfair from the point of view of levelling up to those people who are less well off and are more likely to have the diesel and older cars. So how do we address that issue? That's the first question.
Right, Oliver, that's one for you. I must say, I mean, we hear a lot about how it works against poorer people, the ultra low emission zones.
Yeah. Well, I think the first thing I'll say is, like I said in my presentation, it's actually the very poorest in society who are the ones using the bus, standing by the side of the road, suffering from the bus cuts, breathing in the fumes, and don't actually own a car. So the clean air zones are there to kind of remove some of those most polluting cars going down those roads to actually benefit their health. And often they're the ones that live on these like busy arterial roads. So quite often I've had thrown at me recently in London, out of London's sort of leafy suburbs, or actually there's some major roads going through the out of London boroughs, and people actually live on them. So it's worth people looking out at their windscreen on the way in. But I do agree with you that these schemes can always be implemented more fairly. I think I had a couple of thoughts on it. One is around the record profits that are coming from energy giants at the minute, and the fact that the government is not taking any action to use any of that money to support people to get out of older polluting cars that are harming their own health, but also the health of their communities, and actually funding something that would be significantly targeted at those communities up and down the country that could help to scrap those cars. Because frankly, you know, people were coerced into get diesel cars, and that is, you know, a bit of the theme of today's conversation was how do we align the climate change and the air pollution agenda together? Because it's one thing encouraging diesel for climate change, and then you end up with massive issues in urban areas. So I think the government have a responsibility, and successive governments, that is, to take some action, and they're not doing that, quite frankly, and that is now leading to really difficult choices for city leaders who need to act on the air pollution that their residents suffer, especially the poorest, and especially those who are not contributing the most to it, but actually not getting the support that's required. And related to that is how the government could use that funding to make public transport cheaper for everyone to use, and therefore much more attractive than using their cars. And again, they're not doing that. I would add also, research has been done to look at like the level of NOx emissions coming from communities depending on their income, and it has shown that actually the poorer communities are actually more likely to have some of the oldest petrol cars rather than diesel, because they haven't quite caught up with the introduction of diesel, because they have much older cars. And these clean air zones actually account for the fact that the petrol cars can be really old, up to about 16, 17 years old, because the harmful NOx emissions from the petrol cars are more on level with sort of like some of the newer diesel cars. And something else to add as well will be around the Volkswagen scandal. The fact that the US government got billions of dollars from Volkswagen as a result of that scandal, and we hardly got a penny from the government, hardly got a penny for UK residents. So unfortunately, it's all stacking up to be quite challenging circumstances. You know, on one hand, do you take action because you've got 3,500 young people, for example, in London being admitted to hospital with asthma every year, and these are illnesses that will affect them for the rest of their lives? Or do you actually hold back, take more time, which we don't necessarily have from a climate emergency perspective or air pollution perspective, and not actually intervene? So it kind of to some extent comes down to money. But I would also plead with, it's another sore point for me is with these clean air zones, we've kind of gone, we're now addressing like the the air pollutants, but we're not addressing the carbon emissions necessarily. So it's okay if you can afford a really expensive, massive SUV and then drive into the zone. So why is there not like a high carbon charge being introduced in these schemes that is actually then funding the scrappage scheme for some of the more polluted and poorer communities? So there's definitely more that can be done, and it's a balance that is being had at the minute. That's the best answer I've got for you, but I hope some of those thoughts were helpful.
Before we come to your second question, Terry, I mean, Oliver, can I ask you, I mean, is the ultra low emission zone likely to happen in London, or is the political resistance going to stop it?
It's, I think, really challenging circumstances at the moment. We're seeing a big pushback from quite a loud, the way I would see it, still minority. I mean, the consultation, for example, wasn't hugely representative. I mean, about 4% of people aged under 25 responded to that. They make up about 30% of the population of the city. I think we're really keen. We've kind of not, the health narrative and why we're tackling air pollution and climate change is not coming across sufficiently to the public, and they are kind of now leaning into, sadly, the cost of living crisis that we're kind of facing at the moment is becoming ever so more apparent for everyone. And the health, issue, despite tackling air pollution, saving billions of pounds for the NHS and social care system, is just not coming across. So I would say at the moment it's under threat. And if people are, back behind us and wanting to reduce air pollution and improve our climate, then we really need to hear those voices. And those voices can also come out with caution, along a lot of what I was just talking about there, how we can make things better. But I do wish some of the energy that is thrown at the city leaders for making quite important decisions and difficult ones is also thrown very much at the government. And you've heard me kind of talk today because it's just such an important day as well, given the budget, that I don't think there's enough responsibility being thrown at them at the same time.
Good. So, well, another challenge to us, Oliver. So, Terry, your second question.
Yeah, the second question really is about the flooding risks in the UK. So we expect there to be more frequent and worse floods, but clearly there's an overlap between those who are living in flood zones and those who are living in social disadvantaged areas. And I don't really hear anything about how we're going to tackle that inevitability. And I'm sure most of us have had nightmares at some times about getting flooded ourselves. So it just seems that, again, those people who are the worst off are going to get the worst of the flooding. What should we be doing about this?
Who'd like to take that question? It's a tough one. James, have you got something to say? I mean, if you can't answer the question, say so.
No, sorry, I haven't really worked on flooding. Some of my colleagues do work on flooding, and we've been involved in a project recently in Thamesmead in London where there's flood risk, but I'm afraid it's not something I've really worked on. Other than I completely agree with you that we've just ignored this problem for years and years and carried on building houses on floodplains, and it seems crazy. But I'm sorry, yeah, I don't really have much to add.
Felicity, have you got anything to say?
So the new green infrastructure framework that came in 2022, at the back end of 2022, has got kind of design principles around it. And for example, Portsmouth City Council has looked across, it's got a greening strategy to improve health of its community within the city boundary. And they're addressing using green infrastructure to address surface water flooding, recognizing that communities that have the least access to green space also are those that are more likely to get flooded in kind of heavy storm events. So I think you'll start to see that being tackled because the green infrastructure and framework and standards and a big emphasis on sustainable urban or systems. And of course, so I used to live in an area that did get flooded, in a city that did get flooded, and it was communities you're absolutely right. Links with health inequalities, and also we're suffering from like damp houses and excess mold because of those things. So, interestingly, also a lot of NHS green plans talk about planting trees to have an impact on mitigating surface water flooding and stuff as well. I'm afraid I don't know a lot.
Good, thanks. I mean, that's a good point, Terry. I mean, I think we should think about a future webinar on flooding and its various aspects. We know it has a big impact on mental health. Oliver, you want to say something on this?
Yeah, I will just add, like I said in my presentation, you know, like things I'd love to see really is a ban on like paving over front gardens in urban areas so that we don't get all the rainwater runoff. And also like starting to think about like Lambeth Council are doing, like looking at all the parking on the street and how we can introduce more street trees and sustainable drainage and use that space better, given cars are parked 95% of the time in cities. So
good, thanks. Emily O'Reilly, are you there? Would you like to ask your question?
Hiya, yes, I am. Apologies for not having my camera on. The Cornish internet is not very good. Yeah, my question was for Felicity. I work with GP practices in Cornwall, greening up all the elements of their practice. Loads of them are trying to develop their outdoor space. And I'm sure you get asked this question a lot, but do you know of any grants or funding that is either available now or maybe upcoming that we could potentially apply for?
Yeah, thanks for your question, Emily. I think it depends on what kind of level of funding you're going for. Obviously, being within Cornwall, you've got Cornwall A, and B, and it's probably always worth having a look at sort of community grants that A and Bs may have. If you're looking to sort of join the dots between practices, I would suggest, as in not looking at individual sites, but sites as a collective, I would suggest looking at the National Community Lottery Fund programs. There's one on kind of climate, communities and climate change, and there's one on community cohesion, reaching communities, I think it's called. And both of those programs, for what you suggested, and I saw your message in the chat, would seem kind of an opportunity for you. Froome Medical Practice in Somerset, it may be worth looking at the work of Froome Medical Practice in Somerset. They've linked up with a local organisation and are looking at implementing. They've won funding from the big lottery, or from the National Communities Lottery Fund, to look at implementing a range of measures to reduce the footprint of healthcare within Froome and to increase the sort of nature benefits of healthcare. And that's sort of working on both the clinical side and the outside space side as well.
Yeah, that's great. Thank you. We are often looking at Froome for inspiration. So yeah, definitely. No, thank you. That was that's good. Thank you.
I mean, Felicity, I don't know whether you could, because I was struck when you were speaking, you showed us 3 pictures of hospitals, but if you think about all the number of general practices around the country, is there much going on there with the greening of general practices?
I think there is, and in different situations. Obviously, across sort of general practice, there's different amounts of land available. I think the work of the Lambeth Food Co-op, which you may or may not be aware of, has been brilliant in terms of opening up some of their space for community growing, food growing, but also reaching out into other community spaces, not kind of owned by the NHS estate, to deliver opportunities for their community. I think that there are, I mean, as everybody must be aware, the kind of estate that the primary care occupies is very varied and very different. I do think there's so it's a kind of what is our situation? What is the situation we are in? What context we're in? Who is the population we serve? And what are the opportunities given a physical asset, if you like, and the communities we serve? And in many instances, I guess there isn't an opportunity for greening of the external estate because it doesn't exist. But I guess the question there is who can we link up with locally, and how can we make those relationships locally?
Thanks, Felicity. Anandita, would you like to ask your question?
Hello, am I audible?
Are you there, Anandita? Well, maybe let me ask the question. It's one for you, James. Is there a way to ensure adequate ventilation without compromising the energy efficiency of houses? Are there any examples of countries, cities having successfully achieved this?
Yeah, that's a good question. One of the problems we have in the UK is that the stock is particularly bad, particularly leaky, so it makes it more challenging than some other places in similar kind of climates. Most of the measures, though, are actually quite relatively simple. They're things like, you know, extract fans in kitchens and bathrooms and trickle vents in windows. So they're not necessarily new technologies. If we can get houses to be particularly airtight, you can then install more mechanical systems which, you know, control the ventilation, but also can filter out particles and other air pollutants and things like that. But that's quite disruptive, quite expensive, and it's only if you get the houses very airtight in the first place. And the question mentioned examples of countries or cities that have done this. Where we tend to think about is other parts of Northern Europe, and particularly Scandinavia, where they've essentially done that. More airtight homes. They tend to be warmer, and then often with mechanical ventilation systems. And it seems to have benefits because most of the evidence suggests they have lower burdens of poor health during the cold winter months. And it's not just to do with them being, better adapted to slightly colder weather. There is some suggestion that there's some evidence from Scandinavia that those MVHR systems can be blocked up if they're not maintained properly. But I think as long as we maintain them, then I think that's an example of the sort of thing we should be aiming for. Norway, Finland, Denmark, countries like that.
Yes, we always hear about Scandinavia as a sort of Shangri-La. Ben, would you like to ask your question?
Yeah, thanks, Richard. I think this is for Oliver. I was just interested to hear your thoughts and your kind of campaigning position on e-bikes and e-scooters, because they've obviously proliferated so much in cities over the last few years, and particularly in London. And I just thought, I want to know whether you thought they were kind of an accessible, affordable form of active transport that we should be promoting unambiguously, or whether there's more to it.
There's definitely more to it. I did speak to one councillor not so long ago who actually called them vulture funds, which I don't think is that helpful, because they're entirely sort of private firms sort of putting all these new things on the streets. But I think they've got a massive role to play in urban transport, because I think they help to micromobility. This all kind of falls under, to use the transport term, and I think it helps to democratize it a little bit, because it makes the use of that system more accessible for people who aren't necessarily able to pedal cycle themselves, for example, or even, quite frankly, store a bike at home. Like I was saying in the campaigning, at least these shared services you can actually get on the street, you share it with someone else. So from an environmental perspective and accessibility perspective, they're quite cool. The pricing is still a bit off for me. I think some of the services that I've experienced in London, there might be a role for the public sector to help either subsidize or make them easier for the operators, such as removing sort of redundant car parking spaces so that they're kind of they can park them and use them more. There is quite a lot of debate around, again, on the accessibility side, whether they're blocking pavements and how they're parked. And quite frankly, that comes down to just some really inconsiderate people in society who don't think, you know, putting something in the middle of the pavement is the right place to put it. But I think there are better models to try and fix that. But I do kind of tear my hair out when it was only the other day Westminster Council announced no parking zones in the West End. And doesn't that sound great in a way, because the West End is an absolute hellhole right now, but with the amount of cars. But actually the no parking zone applies to e-bikes, nothing else. So I was kind of like, oh, I was just like, what? Are we not even talking about reducing the number of cars in the West End at the same time? So it's a healthy debate. I think e-bikes, e-scooters, we should absolutely get behind. I think there are ways to improve it, ways to make it benefit the public purse better. But they are having a big reduction as well in car trips. And I just put a link in the chat to the national report on the e-scooter trials recently. So, and as a campaign, we're going to be putting out a report called Thank You for Sharing, which is going to be looking into how cities are embracing e-scooters and things like that. And that should come out in June. So if you sign up to our newsletter, then you'll definitely get hold of that.
So Oliver, I can't help it. I mean, I live in Lambeth and I cycle all the time in London, and I have these people on electric bikes go past me at sort of 30 miles an hour when they're not even pedaling. And it sort of feels a bit kind of strange. And then I worry as well about, you know, cyclists are just getting worse and worse in London at ignoring all the traffic lights and such like. Do you think there's a real danger that there could be a backlash against cycling because of the way? I mean, someone was killed the other day, weren't they? There was a trial of somebody was killed by an e-scooter, and similarly with bikes. I just worry there could be a backlash because of the behaviour of cyclists.
Well, I think that backlash has been around for a while now, but the e-scooter, private e-scooter, so I was talking very much about the public systems at the minute, but the private e-scooters that people own themselves and e-bikes, which have mostly been bikes that have been retrofitted to slap on like big batteries that can make you go at 30 miles an hour, we absolutely need to crack down on that. Hugely dangerous, and you know, but we're getting this sort of like rogue system now where people are adapting their own things or buying off the black market sort of e-scooters and stuff, because we're not doing some better as in public policy. We're not like enabling the companies who actually want to supply these services. We're not enabling to do it better and more coherently across the city. So I would say the result of all that stuff is because we're not actually reacting to it, responding to it good enough as society. An example of that is also how we had to react to when Uber arrived in our transport system. And I was at Transport for London at the time and City Hall, and just the way you kind of like the authorities move to adapt to these digital disruptors is just not good enough. And I think the same is now happening with e-scooters and e-bikes.
Right, we've got just a few minutes left. Heather, you can make your last point, ask your question.
Hi, I'm Heather Lambert. I live in Newcastle upon Tyne, and I ride bikes with a group called Ride for Their Lives, and we're trying to kind of inspire healthcare professionals to kind of bring up the arguments about climate emergency and air pollution in their everyday kind of language. And I suppose my question was about how do we get past this tipping point of the political will to make changes? I mean, there are just some things which are so obviously right to do, and like reducing air pollution. You know, the health benefits, the economic benefits, I think, you know, there's plenty of evidence for that. And we also have some blueprints. You know, we have the Oslo Street Design Manual, we have all the manuals from the Netherlands, we have all the evidence about kind of active travel. And how do we get past this tipping point of people knowing the science and knowing and understanding the research, but actually getting the political will to do something about it? I mean, here in Newcastle, I've got a council that's just introduced a clean air zone, and we did a bicycle ride around it and a walk to celebrate it and say, yes, council, you're doing the right thing. We're totally behind you. We've got all the health arguments. And yet they are ripping out changes that they made during COVID to make bike lanes. And so you've got these double standards going on. How do we get to that tipping point and move things along faster?
Well, there's a very tough question. I'll ask each of you just to make a few comments because we really ought to be finishing in just a moment. So James, first, what do you like to say?
I wish I had a good answer. We're notoriously bad in academia at sort of translating the outputs of research. The one thing I would say is that what I think we're now trying to do, and I'd recommend that other people in academia do, is to try and work with policymakers as part of the research to try and understand what they actually need. And that's what we're trying to do in a few projects, to try and understand these kind of complex urban systems and trying to understand where we can help, where our evidence is useful, and specifically what that evidence looks like. What do they need? But I'm afraid I don't have a good example, and I share your frustration that we're not doing a lot of things that we know would work.
Oliver, a quick answer.
I've said it quite a lot on this call. I think the power of health professionals speaking out is great. I love Ride for Their Lives. I think you're doing something around London as well soon, aren't you? So it'd be great to connect. Showing that there's demand for these, rallying the silent majority public to speak up a bit more, you know, call-ins on radios and things like that, social media, helping us to have shared images that we can all share on social media and kick up a stink, but also pushing on the economic benefits messaging a bit better. I think, you know, money really drives a lot of these decision makers. Taking out a cycle lane is maybe not the right example for me to give there, but billions saved to the NHS and social care system. We just need to get better at kind of communicating that to people somehow, and I appreciate we're not kind of spot on at the minute.
Thanks. Felicity?
I think I'd build on both what James and Oliver has said. James talked about the link between policy and academia, and I think the link that, in terms of how we put things into practice, needs to be made as well. So perhaps really listening to the lived experience of people who are going to be impacted by policy, or who may be able to kind of, by listening to their lived experience, direct us into where there are kind of research gaps. So I think sort of that triangle between policy, academia and lived experience is really important. And sort of building on Oliver's point, I think we're all kind of lots of different disciplines are kind of pivoting towards the same goal, aren't we, in terms of dealing with the climate emergency, the health emergency and the ecological emergency. And I think there's something about understanding how we all work in that interdisciplinary space. So
Good. Well, thanks very much, Felicity. Let me just draw out a couple of points. One, I think we understand the importance of evidence for us as a group of health professionals. It's very important that we base what we say on evidence wherever we can. And I think there is a need that came through quite clearly for more and better evidence, and a need to somehow connect that to policymakers. And I think something that's come through again and again in the conversations is the role that health professionals can play. So I think, again, there's a challenge to us to just be more active and more effective in what we do. So let me end by thanking all of our three speakers. Thank you very much for coming. I think the way your talks linked together were very useful and very important. So bye-bye, everybody, and thank you.
thank you, Richard.
Thank you.
Thank you.